Good afternoon and welcome to Dehect's January 29th media briefing on COVID-19 vaccine in South Carolina. I'm Christy Moore, Dehect's Chief Communications Officer, and I'll be facilitating today's briefing with Dr. Brannon Traxler, Dehect Interim Public Health Director. These briefings are held to share the latest updates and answer questions about COVID-19 vaccines in our state. Dehect appreciates the South Carolina press and its commitment to keeping South Carolinians informed. For the run of show, Dr. Traxler will provide a brief update, then we'll have a segment of facilitated questions, and if time allows, I'll open it up at the end for live questions. Before we begin, I'd like to remind everyone to please remain on mute. Dr. Traxler, I will turn it over to you now for today's update.
Thanks, Christy, and good afternoon, everyone. Thanks again for joining us. This will be our fourth media update or telebriefing of the week. We appreciate so much all that you guys are doing to help keep South Carolinians updated with accurate information and timely information of this rapidly evolving, scenario that we are living in during this pandemic and during the vaccine rollout in the United States and in South Carolina. As we discussed yesterday, South Carolina announced the first identified cases in the country of the South Africa variant of the virus for COVID-19, and that variant is called B1351. DHEC continues to work with the CDC to learn more about these two cases, and will provide any new information as it's available. It's important to remember that both individuals have recovered, and the same disease prevention precautions that we have in place, such as masks and physical distancing, are what protect us from the spread of this strain and all currently known strains of the SARS-CoV-2, the virus that causes COVID-19. CDC and DHEC may never be able to determine with certainty where these two individuals contracted the South Africa variant, and our attention is focused on limiting further spread. Sadly, today, with very heavy hearts, we also announced the state's first death due to multi-system inflammatory syndrome in children, commonly called MIS-C. This is a rare health condition that occurs in some children and teenagers who have contracted COVID-19 or have been in contact with someone infected with the virus. At least 42 cases of MIS-C have been reported among children in South Carolina. You can find more information about the location of those cases on our MIS-C webpage, which is available via our main COVID-19 webpage. On July 12th, we announced our first confirmed cases of MIS-C in the state, and we are very deeply saddened to announce this first death from it today. It is important to know that the vast majority of children with MIS-C do recover. In regards to a COVID-19 vaccine update, we also announced today that we have a new vaccine-only call center launched to answer questions about COVID-19 vaccines and to help support people who are looking for vaccine provider information. That new COVID-19 vaccine information line is 1-866-365-8110. Again, that new COVID-19 vaccine information line is 1-866-365-8110. This new vaccine information line has 240 phone operators, and it's available from 7 a.m. to 7 p.m., 7 days a week. People who have questions about the COVID-19 vaccines or who need help finding vaccine providers and their contact information are asked to call the Dehect COVID-19 vaccine information line. Our care line is still up and operational. However, the care line assists people with general questions about COVID-19 testing or people who need to schedule an appointment at a Dehect Health Department for family planning, well child checkups, WIC services, HIV or STI screenings, and other Dehect services. We do appreciate, again, you all sharing with your audiences this new COVID-19 vaccine information line. That number is 1-866-365-8110. And as an update on the vaccine scheduler tool, our IT folks are continuing to finalize it as a more user-friendly way to schedule appointments and to alleviate some of the issues that with people who are needing computers, internet, or email addresses to schedule appointments. So with that, we'll turn it over to questions. Thank you.
Thank you, Dr. Traxler. Our first question today. The CDC's director says the fact that these two cases of the South African variant have no connection to each other probably means that community spread is already happening. How should South Carolinians perceive this information?
South Carolinians need to use this news of the variant having been identified here as a reason to double down on our efforts, each of us, to protect themselves and others from all versions of this virus. It should serve as a reminder of the importance of mask wearing, physical distancing, avoiding large crowds or group gatherings, getting tested regularly, and especially if you feel sick at all, and of doing good hand hygiene, and certainly following isolation and quarantine guidance from DHEC or healthcare providers.
Has DHEC been in contact with other states about the South African variant found in South Carolina? And has any additional information emerged about how the variant got here?
So I have not at least been in direct communication with other states, and I am not aware of anyone at DHEC having communicated about these specific cases with any other state. And so at this time, we as we stated, know that these individuals did not have a recent travel history and did not have a connection to each other. And so, as I pointed out just then in my briefing, we may never know exactly where these folks got it. But the important thing to remember is what we're focused on is preventing further spread. We want to stop any future spread of it.
And can we say with certainty the South African variant is not as deadly as the normal COVID-19 virus?
So they are still doing studies. This is much even newer than the COVID-19 normal virus. So there are studies ongoing, but at this time, there's not the data to show that it is more, fatal or deadly than the normal virus.
The Washington Post reports South Africa was already one of the countries worst hit by the coronavirus. But in the 6 weeks since, can't speak today, but in the 6 weeks since a new, more transmissible variant was first publicly announced here, an enormous spike of new cases and deaths has far surpassed previous waves of the pandemic. How concerned are you that this happening in South Carolina with the arrival of the South African variant?
So I am concerned still by the number of COVID-19 cases that we have in our community of all variants, all versions of it. I want to see all of the COVID-19 case counts and hospitalization rates and death counts go down. And so certainly with it being more transmissible, there is the potential that we could see higher increases, but we are doing everything we can with the CDC's help to stop, as I said, any continued spread of it. And I will remind people that just like we need to keep from having any increases in the case counts of our normal virus, it's the same methods that we do to prevent further spread of this variant. There's things like hand washing and physical distancing and avoiding crowds if possible.
And will DHEC begin including the number of identified cases of the South African variant in its daily data reports?
So it's important to understand that these are not diagnostic tests. So not every specimen anywhere worldwide, nationwide, statewide is sequenced. That is a much more intricate test that is more time consuming. And so random samples are chosen. They're to be run either by our lab or by CDC's lab and by private labs. And it is that information that helps provide a picture of what the patterns are looking like in terms of any mutations. So rather than knowing exact counts, it is more important to see what the patterns are emerging. So it's not a day-to-day change in data that would have significance.
And following the news that the Johnson & Johnson vaccine has a lower efficacy rate than the Pfizer or Moderna products, is having the one-dose vaccine worth the lower level of protection?
So protection is good. I would say that any protection right now is certainly better than no protection. And certainly there are benefits to the one-dose vaccine. And using those with some populations and just in terms of getting people reaching the maximum amount of protection from a vaccine series as possible. It is still a valuable tool that we will hopefully have before too long, in our arsenal, along with the Pfizer and the Moderna vaccines. So they all serve their different purposes in different settings and populations that they're best used for, but getting protection from any of the vaccines is very important.
And would DHEC consider giving this one-dose vaccine only to younger people and reserving the better vaccines for the more vulnerable population?
So DHEC will be watching to see if the Johnson & Johnson vaccine or any of the others in development were to get an emergency use authorization from the FDA, then we would be watching closely because the CDC's Advisory Committee on Immunization Practices, that ACIP, would meet and provide guidance also for the use of the whatever the newly authorized vaccine is. And so I think it's really too early for us to say, where we would intend to use it, not knowing, having seen any data or knowing what recommendations might come out in terms of guidance for populations it's best used for.
Okay. What is the process for out-of-state residents getting the vaccine in South Carolina? And secondly, are there any restrictions, and does this lead to a lack of doses in our state?
So out-of-state residents, just like South Carolinians, if they are in Phase 1A, if they're in one of those Phase 1A categories at this time, may receive the vaccine in South Carolina. The process would be the same as it is for South Carolina residents in terms of making an appointment and, following the directions then for that vaccine provider. There are not geographic restrictions. And I do want to remind everyone that while other states people may come into South Carolina to get vaccinated, we also have South Carolinians that have gone out to other states to get vaccinated. And it's really a matter of we need the entire country and the entire world vaccinated to really stop the spread of this virus. And so we are all in this together.
When hospitalization numbers decline, do those decreases include both patients who recovered and were discharged and patients who succumb to COVID-19?
Yes, if you are looking at hospitalization numbers, those are raw numbers that are representing how many people with COVID-19 are hospitalized on a given day, as reported to us by the hospitals. And so if it decreases, it could be for either of those reasons.
Would DHEC consider suspending vaccine allocations to providers found to have intentionally violated the phased guidelines? For example, Georgia has done something similar this week.
So DHEC would certainly be working with the provider to make sure that they understand the guidance and re-emphasizing to them the importance of all vaccine providers following the recommended categories or groups of people that are in that phase. And we would continue to work with them. So I am not aware of any situations where we've not been able to work with providers. I think that in South Carolina, they seem to have a good understanding about the guidance.
And when can DHEC release more VAMS data, such as missed appointments and race or age breakdowns of vaccinations?
So we are working on a dashboard that will provide a lot more detailed information about vaccines, vaccinations, and including things such as demographics. And I expect to have that ready in the coming weeks.
Can we get an update on where the 10,000 extra doses of Moderna will be dispersed?
Sure. So those extra doses of Moderna some have gone to the federal retail pharmacy partnership to be able to go out to retail pharmacies throughout all parts of the state. And then the other part, we're able to target providers in areas where there was less opportunity, for vaccines. So where there were some of the rural areas and such where there were less vaccine providers, we were able to then bring on some additional providers and allocate doses to them.
And I think we had a similar question, Dr. Traxler, earlier in the week. The CDC says teachers should be prioritized, and State Superintendent Molly Spearman has made that official request. Has DHEC determined whether teachers will be granted priority before moving to Phase 1B? And if not, what explanation is being given to teachers for not following CDC guidelines?
So the CDC's guidelines, that Advisory Committee on Immunization Practices, and which is the CDC, has teachers and school staff is frontline essential workers in Phase 1B. And at this time, that is where they are anticipated to be here in South Carolina.
What's the advice for type 1 diabetics regarding taking the vaccine, and when will they be eligible?
So type 1 diabetics could certainly discuss if they have any concerns about their own situation, could consult their physicians, but having type 1 diabetes is not a contraindication or a reason not to get the vaccine. So I would still certainly encourage it for anyone who is eligible to get vaccinated. And those individuals will be eligible depending on the person and other factors such as their occupation or their age. That will determine which phase those people are eligible in.
Okay. And these are going to be the last two questions that were submitted that we'll be asking today, and then I'll open it up for other questions. So I would ask the reporters to raise your hands, and I'll do my best to call on you. So the last two questions here are, what does it mean if a provider has a utilization rate of 195% of its first doses, for example, like the Grand Strand Health? And secondly, is there a factor here that we just that hasn't updated yet in VAMS?
So when scenarios with some discrepancies in data or things that are not quite clear in the reporting out of utilization rates and doses received and administered occur, our Dehect team works with those facilities then and with the VAMS system to identify where the issue might be in terms of whether it is something within VAMS or information is not getting received, directly back and forth. And so we work to then correct those discrepancies as quickly as we can by working with those entities, but it could be a variety of different things.
Thank you, Dr. Traxler. I am going to ask the reporters to only ask one question out of fairness to everyone else. Tina, I just need one question from you, please.
This is Tina Terry that you're referencing?
Yes, ma'am.
I apologize. I didn't know if there was another Tina on the call. Okay, this is Tina Terry with WSOC, and thank you for doing this. We appreciate it. Can you just talk really quickly about why the sequencing, that type of testing, looking for variants is so important? And I know you said that the CDC is doing some of that, as well as private labs, and I think you said even the state is doing some of it as well. Can you elaborate on whether you feel there's a need for more testing capability within the state, and anything you can say on how many samples you're testing on a weekly basis?
Sure. So sequencing for this, which is the whole genome sequencing, which is looking to look at the genetics, literally, of the virus to see if there are mutations, and if so, where those mutations are located, is a very important part of surveillance, especially for a virus such as this one, an RNA virus. One such as COVID-19 virus, the SARS-CoV-2 virus, they mutate to live and live to mutate. And so it's not just looking for mutations, though, it's looking for their locations on that string of the genome, and identifying whether they are in key locations that could make them, for example, more easily to be transmitted or have other impacts. And so by doing surveillance and testing random samples of those, and then analyzing the results and comparing the results to each other, the scientists can look to see what mutations are occurring, how quickly they may be occurring, and whether significant ones are occurring, and see patterns such as have been noticed with the 3 variants that are now known worldwide. And yes, our lab, our Dehect Public Health Laboratory, has been doing sequencing going back to June, and has continued to increase that amount of specimens that are being sequenced, especially here in the last couple of months as these variants have emerged on the worldwide scene. In addition, I know that the CDC has similarly been doing sequencing since very early on in the pandemic, and has also been increasing their amount. And the private labs are certainly providing sequencing as well. And so I think all of those entities were already increasing in how much they were doing. And we will continue on that same trajectory that we had been on to continue to increase surveillance, but also, providing good testing for diagnosis, that PCR testing for people, which is separate from this sequencing.
Jenna at LTX, please ask one question.
Hey, good afternoon, Dr. Traxler. Thank you again. My question is, a CBS News story this morning said South Carolina is ranked second in the nation currently in total cases per 100,000 residents. So I just was curious, are those statistics correlating with what you guys are seeing? And again, thank you for your time.
Sure. And so I'm sorry, I haven't had a chance to watch the news stories from today, so I'm not certain of that data that they're looking at or the comparisons they're making. So I really can't speak intelligently to that. I do know that we have seen some plateauing and potentially maybe a little bit of the start of some decreasing in our case counts and percent positivity here in the last couple of weeks. And I want to use that as an encouraging sign. But that and the knowledge of this variant to really remind and urge and encourage everyone to please, continue to do the protective mechanisms that we know work. And let's get these counts down even further.
Judy, you've got one question, please.
Good afternoon. Thank you so much. Just a quick question about our assessment right now. I know you're using a lot of factors, including supply versus demand, but we also have the increased supply coming in next week. So what's your best assessment based on all of the things you're considering on when phase 1B will start? Thank you.
Sure. So I think that at this point in time, without having factored in, again, this morning's news that there may be an additional vaccine getting its emergency use authorization very soon, but knowing that it and potentially others could be coming on in the coming months, I think we're still on target probably for early spring.
Caroline?
Thank you so much, Dr. Traxler. So I heard this morning from a Prisma Health doctor that he's been in touch with DHEC, and you guys are receiving additional resources from the CDC to do this sequencing. Have you guys been in touch with the CDC about ramping that up to see what the variant is like here actually in our state?
Certainly. So as I pointed out, we've been doing the sequencing and had been ramping it up already in our state before we even identified these cases. So we are continuing to do so. We have been in frequent touch with the CDC, and we'll continue to work with them and sending them specimens just like we've been doing beforehand. And we'll continue doing our own sequencing as well.
Ms. Harris, please ask your question.
Hi there. So South Carolina first had a pretty slow vaccine rollout, but I understand it's really ramped up. What's new? What's the update with the vaccine rollout? How are you guys doing? And what's your biggest problem right now?
Sure. So I think that the vaccine rollout is going significantly better at this time. We are seeing the utilization rate really remaining up there, and I really want to commend our partners and those vaccine providers who are putting shots in arms, very much all day, every day. And so I commend them. It's really has been a team effort to increase the vaccine utilization, and I can see it continuing to do so. And at this point, the biggest need we have is for more vaccine, more doses to be coming into the state.
Sam, please ask your question.
Hey, Dr. Traxler, thanks for your time. Are you expecting the new registration portal to launch next week? I was checking the news clips before hopping on this, and it seemed like originally we were expecting the portal to launch at the same time or around the same time as the call line. Could you just walk us through any timeline updates on that?
So I do expect that it'll be rolling out in the near future. I don't have a specific day that I can estimate for you, but I do anticipate it shortly.
Anyone else with a question? Madison?
Yeah, thank you, Dr. Traxler. On the topic of the scheduler, can you describe for us what that will actually look like at this point? And I don't know if I misheard you from earlier, but it sounded like you said something about making sure that folks who don't have a computer having access to that in some capacity. What will this actually look like? Will it be a website, or what will that entail at this point? Thank you.
Sure. So we are looking for it to the scheduler itself to be a website, a portal where you can go in and put in your information, answer a few questions, and see available appointments and schedule it, which is significantly more simple and straightforward than the current process with VAMs, as you all have heard about. And we anticipate that we will be able to help provide support to folks, if necessary, who may not have access to internet or computers or even email addresses, to help get some of those scheduled.
Judy, you've got another question?
I do. Thank you so much. Dr. Traxler, I wanted to follow up regarding the demographics. DHEC has done such a great job in terms of breaking down the impact of COVID on communities of color, specifically on minorities. Will those kind of breakdowns also be available, or maybe you've already put out some data that I haven't seen on the website, but will that kind of demographic breakdown be available in terms of vaccine distribution to be able to make a correlation if the people who are more severely impacted are also getting access to the vaccines?
So I cannot speak to the exact specifics of what the dashboard is going to be showing in terms of especially vaccine distribution or administration, just because our data experts are still building it and getting this data out of VAMs, which is about as complicated as getting your information into VAMs. But we do intend to provide, a broad wealth of information as much as we can to people.
Are there any other questions?